The best ways to repair nerve damage. Neuropathy. Nerve damage, or neuropathy, can significantly impact a person's quality of life, causing pain, numbness, tingling, or weakness, especially in the hands and feet. It can result from various causes, including diabetes, injuries, infections, or nutritional deficiencies. While nerves take time to heal, there are effective strategies to repair nerve damage and support recovery. 1. Focus on proper nutrition. Nutrition plays a vital role in nerve health. Certain vitamins and minerals help repair and regenerate nerves. 1. Vitamin B complex. Vitamins B1, B6, and B12 are essential for nerve function and repair. 1. B12 deficiency is a common cause of neuropathy. 2. Omega-3 fatty acids, found in fish like salmon and walnuts. Omega-3s support nerve regeneration and reduce inflammation. 3. Antioxidants, vitamins E and C, found in fruits and vegetables, combat oxidative stress that damages nerves. 4. Magnesium, known for its nerve-calming properties. Magnesium-rich foods like spinach and almonds can help reduce symptoms. 2. Manage blood sugar levels for individuals with diabetes. Controlling blood sugar is critical to preventing further nerve damage. Stable blood sugar levels help minimize oxidative stress and inflammation, which can worsen neuropathy. Work with a healthcare provider to create a tailored diet and medication plan for optimal glucose control. 3. Engage in regular exercise. Exercise promotes blood flow, reduces inflammation, and stimulates nerve healing. Low-impact activities like walking, swimming, or yoga can be highly beneficial. Physical activity also improves overall circulation, delivering essential nutrients to damaged nerves and boosting recovery. 4. Use nerve-repairing supplements. Certain supplements are effective in repairing nerve damage. 1. Alpha-lipoic acid, ALA. This antioxidant reduces inflammation and improves nerve function. 1. It's especially beneficial for diabetic neuropathy. 2. Acetyl L-carnitine. This amino acid promotes nerve repair and reduces pain. Always consult a healthcare professional before starting supplements to ensure they're appropriate for your needs. 5. Consider physical therapy. Physical therapy and occupational therapy can help restore function and reduce discomfort caused by nerve damage. Therapists use targeted exercises and techniques to rebuild strength, coordination, and flexibility. 6. Explore alternative therapies. Several holistic therapies may provide relief and support nerve healing. 1. Acupuncture. This ancient practice has been shown to improve blood flow and nerve function. 2. Massage therapy. Regular massages help reduce muscle tension and improve circulation to affected areas. 3. Electrical nerve stimulation, TNS. This therapy involves using electrical currents to stimulate nerve function and reduce pain. 7. Prioritize rest and stress management. Nerves need time and rest to heal. Chronic stress can hinder the repair process by increasing inflammation. Incorporate stress-reducing activities such as meditation, deep breathing, or gentle stretching into your daily routine. Conclusion: repairing nerve damage takes time, patience, and a multifaceted approach. Combining proper nutrition, regular exercise, supplements, and professional therapies can significantly improve nerve function and reduce symptoms. Always work closely with a healthcare provider to create a personalized plan that best addresses